Good morning, afternoon, evening, everyone from wherever you join us today. With the audience permission and on behalf of the Walmart University, a heartfelt welcome goes to Walmart University alumni, wherever in the world you are dialing in. I am Maria Carrera, a lecturer and researcher at the Maritime Safety and Environmental Administration at WMU. Myself, together with Inga Bartu-Saviceni, Associate Professor of the Maritime Training and Education Specialization, host this webinar today. The webinar will be recorded for dissemination purposes. This is the first session of a two-part series focused on seafarers' mental health and well-being. Under the topic Translating Research into Practice, the session brings together the researchers of 4 recent studies published in a special issue of the healthcare journal Inquirer, the Journal of Healthcare Organization, Provision and Financing by SAGE Publisher. We would like to thank SAGE Publisher for giving visibility to seafarers' work and lives through these publications. 4 more studies will be presented in the second webinar scheduled for the 14th of November under the theme Lives and Dignity at Sea. October is dedicated to mental health awareness. World Mental Health Day is celebrated every year on October the 10th, and 2024 focuses on the theme Mental Health at Work. Indeed, safe and healthy working environments are essential to mental well-being. As today's presentations will stress, seafaring takes place in a high-risk environment, and sea workers operate under high pressure, far from their families and distant from shore communities, which creates barriers to their care and support. This distant context profoundly shapes their work and lives and may affect their mental health. We must remember that mental health is not only a personal struggle or endeavor, but also a shared responsibility of the entire industry. At work, seafarers need effective mechanisms to prevent mental health risk, protect and promote their well-being, and support them with mental health conditions. Up-to-date studies presented will examine the contributory factors to seafarers' ecological well-being, also to work-life balance, work effectiveness, and retention matters, and also mental health assessment methods will be included in this session. The presentations will be followed by a panel discussion in which researchers will be joined by a maritime clinical psychologist and psychotherapist, Mr. Charles Watkins from Mental Health Support Solutions, to discuss how to translate research into action and build a safer and healthier work environment for sea workers. Now I will turn over to my colleague Inga, who will introduce the panelists and their presentations. So Inga, please, over to you.
Thank you very much, Maria. Good morning, good afternoon, good evening for everyone. I'm happy to not to see, but feel you here in our session. And I'm happy to co-host the webinar together with Dr. Maria Carrera. I would like to mention that we had almost 300 registered participants. However, now I see that we have more than 60 joined. We expect that by taking part in today's webinar, you will not only gain valuable insights from our expert speakers, but also have the opportunity to virtually reconnect with WMU alumni to rebuild meaningful connections. Additionally, we think that this webinar fosters collaboration across the global maritime network, helping to strengthen partnership and addressing this important issue of mental health and well-being of seafarers. We think that only working together, we can ensure a healthier, more resilient workforce that is better equipped to meet the demands of this vital profession. I would like to invite you to travel a little bit, and we will be visiting several countries. We will start with Sweden. And I would like, yes, just a reminder, every panelist has only 12 minutes to present, and we will take one question from the chat, and please put your questions in the chat. Only one will be selected and answered, but others will be answered in written form. So, Ms. Rebecca Hayes-Mejia, Public Health Manager from Lund University and Marine Benefits AS from Sweden. She will present her and Mr. Strom's research on well-being and happiness and their association with working conditions at sea by analyzing data from an unprecedented sample of 13,008 international seafarers. They explored the relationship between work experiences, self-reported well-being, and happiness among seafarers. So, Rebecca, please, over to you.
Thank you. Hold on, and I will share my screen here. Let's see. Thank you for having me here, and I'm excited to share the results from mine and Dr. Martin Stavström's research on well-being and happiness and the association with working conditions at sea. So it's a cross-sectional study among global seafarers. So, let's see here. Sorry. There we go. So the aim of this study was to investigate whether seafarers' self-reported work experiences, how they are associated with well-being and happiness while on board. So we're looking at happiness and well-being, and they are both subjective experiences, but they are related to each other, but they also represent different aspects of a person's emotional and mental state. Happiness is a positive state of joy, contentment, satisfaction, and there we use the subjective happiness scale to measure happiness. Well-being is more a holistic concept. It also includes happiness, but it also includes sort of broader dimensions of life overall. And these work experiences are of work satisfaction, the individual's job work, compensation, working conditions, relationships with colleagues, and so on. But it's also expectations. Does this work meet the employee's expectations regarding their role, his responsibilities, and work environment? Skills, ideal job is how closely an employee's current job matches the vision of a perfect job in terms of duties. Skills and training is on the relevance of the employee's skills that he has in relation to his duties. And then challenges is the level of difficulty and complexity of what they're doing that they face in relation to the time that they're given to carry out this. And then lastly, also workload. How much work is assigned to the seafarers during a specific time frame. So for this research, we did first a bivariate logistic regression, followed by a multivariate regression, and then lastly, stratified multivariate regression analysis. So a little bit about the background. Seafaring, as mentioned by earlier, seafaring is a challenging and high-risk occupation. We have the chemical, biological, and different ergonomic hazards. Shift work is noisy, you're lonely, there are a lot of psychosocial environment, and it's challenging. And this does have an impact on the mental health of seafarers. In another research that I did, also together with Dr. Stavström, we were looking at the outcomes of stress, anxiety, and depression among seafarers. And this is actually the same data set, including 18,000 seafarers. And there, some of the results here showed that seafarers on board were significantly more stressed, anxious, depression was, and depressed compared to those and at home. So this means that something in the environment on board that affects their health and well-being in relation to stress, anxiety, and depression. However, despite the many hardship, the challenging work that they do have, and despite that, many do report mental health challenges. We also need to remember that most actually report high job satisfaction. They're highly committed, and they are also doing quite well. So why do we want to study happiness and well-being among seafarers? Well, to start with, it is by using a salutogenic approach. This is focusing on the areas in a person's life, in this case at the workplace, that actually affects and supports health and well-being. It brings about positive health outcomes rather than looking at sort of the negative outcomes. In the big population, we can bring them a little bit to even a lower risk by supporting a positive workplace. We might reduce people falling into the high risk levels. So it is a way to address the general state of mind, as it is a better indicator when if we want to analyze retention rates. So rather doing this than psychiatric diagnosis. We know from a lot of research that well-being and happiness of crew is linked to safety issues and safe voyages. So here we want to understand the link between the working conditions and happiness and well-being. So we also know that a supportive and engaging workplace is associated with positive psychological and as well as physical health, contributing to job satisfaction and work engagement. So this data that we have was collected in February to March of 2022. This is just shortly after the pandemic. And it is a collaboration between Lund University and Marine Benefits. So we did get a total of close to 25,000 seafarers that responded to this survey from 44 different shipping companies. For this study, however, we're using the data from seafarers that are only on board. So those who are off duty that also took the survey have been excluded from this survey. So we want to look at sort of the working environment and what affects them when they are on board. 77% reported having high well-being, and 82% reported being happy, according to those scales that we use. So the first bivariate analysis showed that we did have that there were a lot of both happiness and well-being were significantly associated to the happiness and well-being are both associated to the work environment. But going further, when we looked into the different areas and we used a stratifying, when we adjust these outcomes here, we have the satisfaction, expectations, the exposure variables. When we adjust them for age out, and also in the third model, when we adjust for also psychosocial environmental factors, we did see that workload had there's a lot of data here, but I want to focus on the workload because we did see that had a negative significant correlation. So there was something with the word workload that made the results differ a little bit. So we wanted to look deeper into this. So then we have here at the top, we have the well-being scale here and the happiness scale here. And we stratified the workload into low workload, medium workload, and high workload. So here we see in the low workload, many of these relationships are not significant when it comes to workload. However, medium workload, we can see that is beneficial for happiness and well-being. High workload, on the other hand, again, is not beneficial for the outcome of health, happiness and well-being. So in other words, the level of workload modifies the association between the work experience I have and the outcome of well-being and happiness. So having just the right amount to do is beneficial for well-being and happiness. And of course, it is a to some extent, it is a subjective experience, what is just the right, because we're all different and we can handle different levels. But that also depends on level of skill. But a medium workload also brings about this sense of feeling of mastery, that I am in control. And that also brings about happiness and well-being and contentness. So a little bit of the results. Again, a majority with looking at these workplace experiences listed here to the left, most do report well-being and happiness. And well-being and happiness were significantly associated to work environment factors, except for the workload, where there was sort of a reversed relationship. The odds of well-being and happiness is significantly higher with satisfaction and expectations. Having skills and challenges at work increases the odds of happiness. The odds of well-being and happiness reduced with increased workloads. So with this, the workload environment has a great impact on well-being of seafarers, and high job demands that are not in line with the resources at hand. It could be organizational, but it could also be individual resources, may result in reduced well-being and happiness. So the link between demands and procedures on board and feelings of happiness and well-being cannot be explained only by individual psychosocial experiences, but rather how on-board processes and tasks are organized and structured on board. So how work is organized on board can be managed in better or worse ways. So in their own words, these are some of the seafarers from some of the surveys that we sent out. Some of their, there's a lot, we have a lot of these, but these are some of them that I picked out. Being a seafarer is not easy. There are times when we experience boredom, homesickness, and loneliness. The length of contract for senior officers is the biggest factor of well-being. The workload is relentless, which is understandable in the competitive market, but longer contracts severely diminish performance towards the end of the duration on board. This is a significant factor which affects mental well-being and safety on board, as well as the happy willingness to join again. The company have made many changes during the last year and still coming more challenges. This is overloading, notably the spirit of the crew, and it's too much work, new systems that are a nightmare and very hard work. Some people will quit, and there are talent that will leave if they see their salaries reduced. Mental health is really important on board. This is why connections to families and friends has to be constant. A happy and comfortable working environment will make our lives easier on board, which makes us more productive and safety conscious on what we do. I'm happy to stay on board, but in regard to our own health and well-being, I wish the company would raise attention to more healthy food on board, more hygienic facilities, and leadership training in regard to respecting and motivating one's lower ranks and cultures. I hope I have some more time. So just to conclude, emphasis on work-related factors can improve seafarers' well-being and happiness. So how can we do this? Regular monitoring of workload, prevent stress and burnout, recognize reorganizations of duties, ensure that tasks are evenly and distributed, and flexible scheduling, timely crew changes, implementing adequate rest hours in rotation scheduling, investment in training and skills development also will also enhance competence and confidence among the seafarers. Encouragement on feedback and communication to ensure seafarers that they understand their roles and responsibility and that they feel supported. Thank you so much. That was what I had for you.
Thank you. Thank you. Excellent, Rebecca. I'm amazed with the number of participants in your research. So 13,000. That's a great number. We have a question from the audience, from Peng Lui. As you mentioned, happiness and well-being is a critical factor related with safety. But the problem is how we can evaluate it, like PSCO, Port State Control Officers. It's not possible for them to issue the deficiency about the happiness during the Port State Control inspections. Can you provide any answer to this question?
Yeah, I think maybe as in an inspection, I think maybe it would be difficult to measure the happiness, but maybe more on satisfaction and ask how the environment is, talk about workload and those areas that actually are affecting the outcome of happiness and well-being.
Yeah, thank you. Thank you so much. Thank you. So there are some questions in the chat regarding recordings. Recordings will be shared, and full papers you can find in special issue of Inquiry Journal. We will send the link to the special issue as well to all of you. And now let's move to Georgia. In Lithuania, we call this Sakartvelas. And Dr. George Gabedava, professor at Batuim Navigation Teaching University, Matia, Georgia. He will present the research performed by the group of researchers from 3 countries, Georgia, Slovenia, and China, which involved seafarers from 12 countries. The research provides a comprehensive understanding of seafarers' mental health by identifying key stressors and their impact on career intentions. So, Dr. George, over to you.
Can you hear me? Good afternoon,
Yes.
everybody. As Inga mentioned, today I will be presenting our research on seafarers' mental health and well-being, factors impacted seafarers' mental and career intention. And it's my pleasure to be like a panelist for this webinar today, organized by the World Maritime University. The mental health of seafarers is a crucial issue that has long been overlooked in the maritime industry. This profession, dated back over about 3,000 years, faces unique challenges that can significantly impact psychological well-being. These challenges have been further intensified by the recent COVID-19 pandemic, and our research aims to shed light on these issues and provide practical recommendations for improving mental health support in the maritime sector. By addressing this crucial topic, we can enhance safety, job satisfaction, and overall well-being for the 1.7 million seafarers worldwide who plays a vital role in a global trade and economy. As it is mentioned already, the research was done by the group of the people from specialists from the University of Ljubljana, Dalian Maritime University, Batumi Navigation Teaching University, and the study has been conducted through the support of the International Association of Maritime Universities and the Nippon Foundation in Japan. Seafaring is one of the humanity's oldest profession, with a history stretching back over 3,000 years from the ancient time to today's modern merchant fleets. Seafarers have always faced unique challenges that test both physical and mental resilience. The nature of the job, long periods away from home, isolation, confined spaces, and unpredictable weather has always posed mental health risks. However, these traditional challenges have been significantly amplified in recent years, particularly due to the COVID-19 pandemic. The pandemic brought difficulties, extended time at sea due to port restrictions, crew change crisis, fear of infection, and increased isolation as shore leave became limited or non-existent. Many seafarers found themselves stuck on ships for months beyond their contract, separated from families and facing uncertainty about their return. This crisis highlighted and accelerated existing mental health issues in the maritime industry. It became clear that the psychological preparation and support provided to seafarers were inadequate to meet these extraordinary challenges. Our research aims to address this gap by examining the current state of seafarers' mental health, identifying key stressors, and proposing practical solutions for both the industry and maritime education. Our study had four primary objectives, each aimed at addressing the critical issues of seafarers' mental health and well-being. First, we set out to identify the key risk factors causing psychological discomfort among seafarers. Understanding these factors is crucial for developing targeted interventions and support systems. Second, we aimed to determine the level and intensity of these risk factors. This quantification helps prioritize issues and allocate resources effectively. Third, our goal was to create practical recommendations for dealing with psychological problems in the maritime industry. These recommendations are designed for implementation at various levels, from individual seafarers to shipping companies and regulatory bodies. Finally, we worked to develop a comprehensive manual of undergraduate students in maritime studies. With this manual aims to better prepare future seafarers for the psychological challenges they may face in their careers, addressing the crucial gap in current maritime education. By achieving these objectives, our study not only contributes to academic understanding of seafarers' mental health, but also provides practical tools and strategies for immediate implementation in the industry. Regarding the methodology, our study employed a comprehensive multi-faceted approach to ensure robust and reliable results. We utilized 5 key methodological components. First, we conducted oral interviews and questionnaire surveys with seafarers. With direct engagement allowed us to gather first-hand accounts of their experience and challenges, and we interviewed about 450 active seafarers. Second, we proposed the collected data using SPSS, the statistical package for social science. This sophisticated tool helped us identify patterns and correlations with the data. Third, we employed them. We use analysis tool of SCL90. And also, fourth, we performed comparative analysis, examining our findings against existing literature and studies in the field. This helped contextualize our result with the broader landscape of maritime mental health research. And lastly, we synthesized and generalized our findings, drawing meaningful conclusions and actionable insights from the wealth of data we gathered. Key findings, what we found based on our research. First, the type of work schedule emerged as a crucial factor. Long hours, irregular shifts, and the constant demands can lead to fatigue and stress. Second, previous negative employment experiences play a significant role. Past traumatic events or difficult voyages can have lasting psychological effects, influencing a seafarer's current mental state. Third, we found a concerning low level of psychological training among seafarers. Many lack of the tools and techniques to effectively manage stress and maintain mental well-being in challenging situations. Fourth, insufficient means of communication stood out as a major stressor. Limited contact with family and friends ashore can lead to feelings of isolation and disconnection. Lastly, insufficient interpersonal communication on board also emerged as a significant issue. The multicultural nature of crews, language barriers, and limited social interactions can create a sense of loneliness even in a crowded ship environment. These factors often interact and compound each other, creating a complex web of stressors that seafarers navigate daily. Understanding these key stress factors is crucial for developing effective interventions and support systems. Common psychological problem, depression emerged as a significant issue. The isolation, monotony, and separation from loved ones can lead to persistent feelings of sadness and hopelessness. Secondly, anxiety is widespread. The constant pressure of responsibility, potential dangers at sea, and uncertainty about the future can trigger anxiety disorders. Also, we observed high levels of hostility, the confined environment, cultural differences, and prolonged periods of stress can lead to increased irritability and aggression. Fourth is somatization, which is very common. This is where psychological distress manifests as psychical symptoms, often leading to unexplained aches, pains, or fatigue. And lastly, interpersonal sensitivity is a recurring issue. Many seafarers struggle with feelings of inadequacy, particularly in social situations, which can be by the multicultural environment on board. It's crucial to note that these problems often exist and interact. For instance, anxiety can lead to sleep disturbance, which in turn may depression. Understanding this interconnection is key to developing holistic mental health strategies for seafarers. What was the COVID-19 impact in this regard? Pandemic has significantly mental health challenges for seafarers. Our research namely identified 4 key areas of impact. Extended time on board and crew change difficulties became prevalent. Second, reduced shore leave and fear of infection creating a prison-like atmosphere on ships. We observed an alarming increase in cases of severe depression, suicidal thoughts, and instances of aggression. There was a pervasive feelings of abandonment and isolation as well. And recommendations for employees. Based on our findings, we have developed 5 key recommendations for employees in the maritime industry. First, improve medical examination and psychological testing, because I did not mention that during our survey, we interviewed different stakeholders, seafarers, recruitment agencies, and also the regulatory bodies. Those are regulating seafarers' education in our country. And based on this, we made this recommendation for employers: improve medical examination and psychological testing. We recommend implementing more comprehensive pre-employment and regular psychological assessment to identify and address mental health issues early. Second, enhanced training for crew management on mental health issues. This includes educating officers and supervisors on recognizing signs of distress and providing basic psychological first aid. Third, prioritize employee care and interest. This means going beyond mere compliance with regulation to actively create a supportive work environment. This could include better communication facilities, improved living conditions, and more flexible leave policies. Fourth, implement post-contract psychological counseling, offering debriefing session and counseling support after each voyage can help seafarers process their experience and transition back to shore life more smoothly. Lastly, provide psychological support after problematic voyages for crews that have experienced particularly challenging situations, such as severe storms, accidents, and extended isolation. Specialized psychological interventions should be readily available. Educational implications. Our research has significant implications for maritime education. We propose 5 key areas for improvement. Incorporate mental health topics into maritime curricula. This means integrated comprehensive models of psychological well-being, stress management, and resilience into standard training programs. Secondly, teach stress management techniques and coping strategies. Future seafarers should be equipped with practical tools to handle the unique stressors of life at sea, from mediation and mindfulness to cognitive behavioral techniques. Thirdly, promote awareness of psychological first aid. All maritime students should be trained to recognize signs of mental distress in themselves and others and know how to provide initial support. Fourth, emphasize the importance of interpersonal communication skills. Given the multicultural nature of modern crews, strong communication abilities are crucial for maintaining a positive onboard environment. And lastly, include psychological preparation in professional training. This involves simulating challenging scenarios and teaching strategies to maintain mental equilibrium in high-stress situations. By implementing these educational reforms, we can better prepare the next generation of seafarers for the psychological challenges they will face. This proactive approach will not only benefit individual mariners, but also contribute to a safer, more resilient maritime industry as a whole. Self-assessment tools. As part of our research, we identified several self-assessment tools that can be valuable for seafarers in monitoring their mental health. We recommend 5 key instruments. First, the self-rating anxiety scale. It is known like SAS. This tool helps individuals measure their anxiety levels and identify potential anxiety disorders. Second, the self-rating depreciation scale. This scale allows seafarers to assess their depressive symptoms and track changes over time. Third, the Hamilton Anxiety Rating Scale. While typically administered by clinics, a simplified version can be used for self-assessment of anxiety symptoms. Fourth, the Depreciation Anxiety Stress Scale. This comprehensive tool measures 3 related states of depression, anxiety, and stress. And lastly, the CAG alcohol questionnaire. Given the risk of alcohol misuse in the maritime industry, this simple 4-question tool can help individuals assess their relationship with alcohol. It is crucial to note that these tools are for self-assessment only and not as substitute for a professional diagnosis. They can, however, serve as early warning system, helping seafarers recognize then they might need to seek professional help. Basic principles of rendering assistance. First is the assistance should be based on self-help and mutual aid. Second, follow the observing, listening, giving direction principle. This approach ensures that support is tailored to the individual's needs and respects their autonomy. Third, create a supportive and non-judgmental environment. This is crucial for encouraging open discussions about mental health and reducing stigma. Fourth, maintain confidentiality and respect cultural differences. Given the diverse nature of ship crews, cultural sensitivity is paramount in providing effective support. And lastly, know then to refer to professional help. While peer support is valuable, it is essential to recognize the limits of non-professional assistance and seek expert help when needed. And as a conclusion, our research has highlighted that mental health is not just a personal issue for seafarers, but a crucial factor in the safety, efficiency, and sustainability of the entire maritime industry. We have identified key stressors, common psychological problems, and the profound impact of the COVID-19 pandemic on seafarers' mental well-being. Our findings emphasize the urgent need of the comprehensive industry-wide approach to address these challenges. Our recommendations span from improving employer practices and enhancing maritime education to empowering seafarers with self-assessment tools and principles for mutual support. These strategies if implemented, can significantly improve the mental health landscape in the maritime sector. However, this is just the beginning. Continuous research, ongoing implementation of findings, and the commitment to creating supportive environments, both on board and ashore, are essential for long-term progress. That was very brief and short about our research, and I have on the slide the publications related of our research. First article, Research on Seafarers Depreciation, Anxiety, Safe Working Factors and Enemies, was published last year under the framework of the International Association Maritime Universities Conference. Second one, also mentioned by Inga, was published in that Seafarers Mental Health and Wellbeing articles collection titled, this article is titled like Factors Impacting Seafarers Mental Health and Carrying Intentions. And last one, this is the guideline which was published by the research group of this project. This is like a guideline for undergraduate students, and we are going to put it in our educational program and teach students through this guideline. We gave title like Calm Seas, Calm Minds, an introductory guide to seafarers' mental health. Thank you very much for your attention. And sorry if I'm very fast.
Thank you. Thank you, George. And we appreciate that you are saving our time for panel discussion. No, it's okay. The pace is very good. Actually, as MET professional, I was very happy to see that you are thinking about educational aspects, how to address this issue by educational tools. And we have some response or some question from the audience. And Aina Amukvaya, she's actually providing a recommendation. And also she suggests that having unlimited internet, at least for essential apps to help seafarers communicate with their family and loved ones, will be a great step. What do you think about this?
Yeah, that was the issue. Then we are interviewing the seafarers. Almost all of them mentioned about this, that they have limited access to the internet, and they not always have the opportunity to contact their families, even friends. Then sometimes they are feeling depressed or they don't feel good. They want just to talk with friends, not family members maybe, and for that time they do not have this opportunity, and it might be help them if they would have this or kind of unlimited access on the board of communication. Yeah.
Thank you so much, George. And now I would like to move back to Sweden, and I would like to invite our host of our webinar, Dr. Maria Carrera. Actually, she is from Spain, but research she has done involved researchers from France and Sweden as well. So she will present the study assessment methods for seafarers' mental health and well-being during the COVID-19 pandemic. Dr. Carrera, together with Dr. Baumler and Hollander, underscored the need for standardized and validated tools tailored to seafarers' unique circumstances by applying a systematic literature review and analyzing 27 original investigations. Please, Maria, you are very welcome.
Thank you, Inga, and also thank you, Wu, for assisting me in presenting from your side my slides because of technical problems from my side. So this study presents the systematic review that we conducted on the assessment methods for seafarers' mental health and well-being during the COVID-19 pandemic. First, so next slide, please. So what motivated this research? Seafarers have been consistently considered an occupational group vulnerable to developing mental health difficulties. And this vulnerability has been mainly related with their exposure to a harsh working environment and living conditions at sea. However, so far, there has not been attention given at all to the research methods and the psychological instruments we are using to measure seafarers or to understand seafarers' mental health and well-being. Next slide, please. So, indeed, the COVID-19 crisis became like the perfect context for such a study. Because during the COVID-19 crisis, the number of studies about the topic multiplied, and we gave, in general, more attention to seafarers' mental health and well-being. In fact, in 2022, 5 separate literature reviews were conducted on the topic, and this concludes quite clearly what are the main aspects, the main contributors to seafarers' mental health and well-being. And this includes a poor work culture, an uncaring work environment, aspects affecting seafarers' health, fatigue, poor sleep, long working hours, also aspects affecting their social needs, because of the separation from their families, from shore communities. Also, factors affecting their employment conditions, the length of the contract, and the instability of the contracts normally. So just one literature review, Lee et al. Suggested or proposed that there is a gap in the literature because in order to evaluate, because we don't have information about the data sources we are using, the methods we are using related to seafarers' health in general, but specifically on mental health. And this literature review tries or aims to address this gap. So next slide, please. So how was this study conducted? We searched 5 databases, ERIC, Scopus, PubMed, Google Scholar, EBSCO, and we did the search both in the abstract and in the full article. The period explored covered studies conducted between March 2020 and February 2023. We use a 2-step keyword search strategy in which initially we combined the terms COVID-19 or COVID with seafarers and mental health and well-being terms, but then later we included or we added the terms of maritime and shipping to try to find more studies if applicable. The criteria we use for eligibility of these studies were first to be published in English language or in other languages, but at least to have the abstract in English. Studies, we included also studies published in peer-reviewed journals or also part of the great literature like industry or other research reports, for example. And studies should also meet a third criteria, so to include any quantitative or qualitative instrument to measure seafarers' mental health or well-being. Researchers also studied the quality of these the studies included, and for this we use 2 separate tools. For qualitative studies, we use the Critical Appraisal Skills Program, and that is composed of 10 appraisal criteria, and the quantitative for the quantitative research we use the Joanna Briggs Institute Critical Assessment Tool that is composed of 8 criteria. Then we assigned values like 0 if not meeting the criterion, 0.5 if partially meeting the criteria, and 1 if meeting the criteria. And then the researchers convert these total scores into percentages, and the higher the percentage, the better quality of the study. So next slide, please. So the systematic review used the preferred reporting items for systematic reviews and meta-analysis diagram. And as it can be seen on the slides, from the original 277 records, we included finally 27 studies met the inclusion criteria. Out of these 27 studies, 24 were found through the database basis search, and 3 more were found by other means, so using websites or citation searching. Next slide, please. So the studies that were finally included in the systematic review, we extracted additional data and information to be analyzed further, and this included the authors, the year of publication, the region and country of publication, the type of literature, if a peer review paper, if braille literature. Also, we analyzed the sample size and other characteristics of the samples included in the studies. Also, it was very important to identify if any mental health outcome, for example, if depression symptoms or stress symptoms or so on. The data collection method was also analyzed, if face-to-face, if online. The assessment method, either quantitative or qualitative, and if there was any mental health measurement tool, like ad hoc questions or a validated questionnaire, and so on. We also analyzed if there was any kind of reliability and validity measures. And then, as said before, based on all this, the quality of the studies was concluded. Next slide, please. So the findings, most of the studies included in the systematic review and published were published in publications in journals concerning health-related issues, also in journals concerning maritime and ocean matters, and some studies were also published in labor issues journals. Most publications come from Asian countries and also from European countries. Almost all studies, not all, indicate the sample size, which range between 9 in one study to 20 to 42,000 seafarers. Sociodemographic data not included in all studies in most, but in those included this sociodemographic data, there was a varied range of nationalities, ranks, and types of vessels, and in most of the studies, the authors studied multinational crews. The preferred data collection method was online. Next slide, please. So in terms of the assessment tools, assessment methods used to measure seafarers' mental health and well-being, 6 studies use qualitative research, and as part of this, they use open-ended questions, focus group, netography, and also online forum methods. In the qualitative research, there was not a direct mental health outcome assessed, but it was a generic assessment of mental health. How do you feel? Do you feel that COVID, for example, impacted your mental health? But there was an exception, one study in which the practitioners diagnose mental health disorders using psychological phone consultations. For quantitative research, most use 21 studies. In this case, in some studies, 11 use questions, ad hoc questions or indexes designed specifically for the study, so designed by the researchers. The type of ad hoc questions included were, for example, what is your level of happiness or level of stress? How much your mental health and well-being has been affected? Do you suffer from anxiety or sad mood? And there was a couple of studies that analyzed the seafarers' well-being longitudinally. That means that they monitor their well-being over the time and provided a kind of index that can be used for comparison purposes over the time. 10 studies, however, use validated mental health and psychological well-being scales. And in these studies, there was 2 types of instruments, 2 types of psychological instruments. Unidimensional tools that assess mental health in one dimension, either depression symptoms or symptoms or anxiety symptoms. But there was also some studies that analyze mental health in a multidimensional way using scales like, for example, DASS 21 that analyzes symptoms of depression, anxiety, and also stress. But in the quantitative research, most studies didn't include any reliability measures about the use of these instruments, these psychological instruments. Next slide, please. So conclusions. Conclusions. In general, researchers, when they research about mental health of seafarers, favor questionnaires over qualitative analysis. In qualitative exploration, however, the samples are normally small, and researchers don't normally include a justification of the sample size. For quantitative exploration, a number of seafarers use ad hoc generated questions, but in this case, it's difficult to compare studies, and the cost of validity is compromised because there is inconsistency in how we understand mental health. And some studies also use validated screening instruments, but in these cases, normally they don't include reliability and validity measures to understand that these instruments are valid to be used in the seafaring population. So we need more authoritative tools and validation in seafaring population, and we need also more studies that cross-check evidence coming from both quantitative and qualitative analysis. And another important aspect I would like to conclude is that studies, none of them analyze the functional impacts of mental health problems. Either your work performance is affected, your spare time, your relationship, and so on. And this is an important part of understanding mental health. And some recommendations that this study allows us to make. Next slide, please. So first, we recommend to enrich data sets by crossing surveys with qualitative research. Second, we recommend to insert questions from validated questionnaires in ad hoc surveys whenever possible. We also recommend to ensure vocabulary consistency through the studies. Another recommendation concerns conducting studies on the psychometric properties of the questionnaires assessing seafarers' mental health. The fifth recommendation concerns the need to developing sector specificity questions and questions to validate and for future use. And finally, we really need to include a consideration of the impact on functioning of mental health issues for future assessment when assessing and when considering seafarers' mental health. And yeah, my next slide is just to say thank you very much for your attention.
Thank you, Maria. Excellent. So comprehensive study, systematic literature review. You have read a lot of papers during COVID, but I think situation now has changed a little bit. And we have a question from Khalid. It seems that challenges have increased, especially following the pandemic. What do you think? How is the situation now?
Yeah, this is a very interesting question, and yeah, I'm glad that I was asked this question because indeed I agree with what this participant is saying, because yeah, we continue assessing this matter, and definitely the situation is far from have improved after the pandemic. With this study, we assess problems during the pandemic, but of course we can apply these problems to outside pandemics, and the situation tells us that there are more difficulties now than before. For example, seafarers don't have access to shore leave frequently, which is something very important for them to restore and to feel better after hard work. There are other issues that have not changed either during the pandemic or before, like the number of hours seafarers work, and this, how fatigued they feel, and this is impacting, their willingness to either quit or continue developing their profession as seafarers. We see this in many studies we are conducting, and this is quite worrying, right? Because if we don't have mentally prepared workforce and a workforce who really want to develop their jobs, we cannot sail the vessels, So definitely, there are even more issues than before, and this is quite worrying. Yeah, so for the reason this aspect is very important.
Thank you, Maria. Okay, and now let's go to Turkey. And the last but not least, I would like to give the floor to Dr. Nihan Sen Bursa, Associate Professor at Ordu University from Turkey. Together with Dr. Dunder, Dr. Sen Bursa investigated the impact of work-life balance on the work effectiveness of seafarers, with a mediating effect of psychological well-being, organizational happiness, and trust by using structural equation modeling to a data set of 420 seafarers from various Turkish and international vessels. So please, over to you, Dr. Nihan.
Hello, everybody, dear Inga and dear Maria. First of all, thank you very much for organizing this panel. So today I'm going to present you the findings of our research that we have published at your special issue. This is the Associate Professor Dr. Nihan Şambursa from Ordu University Fatsa Marine Sciences Faculty. Our subject is the mediating effect of well-being, happiness, trust in the relationship between work-life balance and work effectiveness in seafarers. So as we all know that seafarers are I call it like this, name them like unsung heroes of international trade. The current number of STCW certified officers stands at almost 900,000, marking 10.8% increase since 2015. So the growing importance of addressing seafarers' mental and physical well-being is increasingly recognized, also much after COVID, as you have already mentioned. Let's see our research objectives. Our objective was to explore the relationship between work-life balance and work effectiveness among seafarers, because we all know that they are living on vessels, they are working on vessels, their home is vessel, their life time, maybe half of their life they live in their vessels. So they work there, they live there, they socialize there. So we wanted to see the relationship between work-life balance and work effectiveness among seafarers, and we investigate the mediating roles of psychological well-being, organizational happiness, and organizational trust. So, and we wanted to analyze the interplay between these factors to identify key intervention areas for improving seafarers' overall well-being and performance. So our methodology was, we had a data set of, Inga, as you have already mentioned, 420 seafarers working on various type of vessels in Turkey under Turkish and international flags. And among the participants, 94% were male, 5% were female. Survey-based data collection and convenience sampling method were used, and our methodology also was statistically structural equation modeling and correlation analysis. And the evaluation of research hypotheses concerning work-life balance, psychological well-being, organizational happiness, organizational trust, and work effectiveness. So let's see our key findings. First of all, I would like to present our hypotheses. Three specific mediation hypothesis models were tested as below. First one was psychological well-being mediates the relationship between work-life balance and work effectiveness. Organizational trust mediates the relationship between work-life balance and work effectiveness. Organizational happiness mediates the relationship between work-life balance and work effectiveness. The correlation analysis indicated statistically significant relationships between all scales. A positive relationship emerged between organizational trust, work effectiveness, and organizational happiness. On the other hand, there is a positive correlation between organizational trust, work effectiveness, and organizational happiness. Finally, a positive inverse correlation was found between work effectiveness and organizational happiness. And the key findings are the mediation analysis indicated that the psychological well-being, organizational trust, and happiness significantly mediate the relationship between work-life balance and work effectiveness. Given the statistically insignificant relationships between work-life balance and work effectiveness, it was determined that psychological well-being and organizational happiness serve as a complete mediators. Also, conversely, in the mediation model involving organizational trust, where the relationship between work-life balance and work effectiveness is statistically significant, organizational trust assumes a partial mediation role. Overall, all hypotheses received statistical support, affirming the importance of these mediating variables in the context of work-life balance, work effectiveness. So full mediation with psychological well-being, we said, full mediation with organizational happiness, and partial mediation of organizational trust between the relationship of work-life balance and work effectiveness. So I didn't get too much into detail with the numbers and statistical data, tables, etc. I would like to conclude how to enhance seafarers' work-life balance and well-being. First of all, seafarers need to undergo pre-embarkation training to manage stress, burnout, and psychological challenges. We all know that they are having problems on board, but sometimes maybe the seafarer is having a mental problems before going on board, or maybe he's having depressions, or maybe he's having some kind of problems, anxiety, burnout, because after working a lot of years on board, it's not very easy to handle this state of mind. So pre-embarkation training is a must. Psychological sessions on coping mechanisms should be part of their preparation before going on board. Online sessions during their service on board. We all know that telesessions has been started, especially right after COVID. Ship owners and operators, they started to give some contracting clinic psychiatrists, psychologists to give some advices to the seafarers as online. So consistent communication, as Rebecca mentioned, with families help seafarers feel connected and reducing isolation and improving mental health. They need to feel belong to a family, so they know that their family are living on shore, but without communication, they feel like lost, or they might have fear of missing out. And maintaining work-life balance on board strengthens seafarers' trust in their organization. No overtime of working. Yes, we know that Maritime Labor Convention has been adopted by many countries, but still there are some that are not adopting the MLC, and they are working overtime, especially in coastal fleets in the Black Sea part. So ship operators and owners should address mental wellness risks, and including suicide, depression, and isolation during seafarers contracts, which we have experienced this situation many times in Turkey. And I think maritime clusters like international non-governmental organizations, governments, ship owners, operators, and policymakers needs to move forward together in order to make proper actions. Ship owners decide something to apply on a vessel, but INGOs doesn't know about that, or INGOs trying to apply this, or maybe ship owners are not ready to apply these rules yet. I think they need to move forward together. Recommendations, what can it be? As Rebecca already mentioned, also we need to shorten contracts durations with this reason or that. Still, there are very, very long contracts are going on among seafarers. So it's very hard to bear that period of time. Also, foster social activities on boards. Yes, this is also applied by some ship operators, but some ship operators are in a rush of operations, so they don't give a lot of importance to these activities. Of course, facilitating internet access so that they can communicate with their loved ones. Minimizing over the long working hours we set, and online psychological well-being support. To observe, I think having constant psychological well-being support will prevent any big action or big depression or any big event. Suicide can be anything. Seafarers that happens on board. So if they have constant psychological help from psychiatrists or psychologists, they might prevent this before. They can monitor them and initiate these for struggling crew members. And stress management techniques. We all know that each ship has their own world. So it depends on the master mariner, it depends on the fleet, the crew of the fleet. So in one company, for example, the organizational climate might be different than one vessel to another. So this also depends on the view and psychology of the master mariners, who is the head of the rest of the crew. And shore leaves are very important. Also during COVID, they had many problems, but still the seafarers, they are complaining that they don't have sufficient shore leaves to recharge and maintain motivation, relaxation, socialization. And crew management involvement, like introducing online sessions, counseling, online psychotherapies, so that they can isolate themselves for working extremely and promote their mental well-being. Thank you for listening.
Thank you, Nihan. Thank you so much for this excellent research. And we have several questions. It's difficult to choose one. Maybe I will take the question from Gina. And it's a comment, but maybe you can provide your opinion, Nihan. From the ITF's view, anxiety over any thought potential public health crisis exacerbated effect on bullying and violence on board and ashore. What do you think? Is this also having some influence on board the ship?
Might be, of course, like anxiety is for seafarers is a big paramount, because seafarers, they start to be anxious before going on board. Like I know many seafarers, they are isolating themselves right before 1 week they go on board. Like they don't want to socialize because they already start preparing their psychology that they will be alone on board. So anxiety, it doesn't happen right in a moment on board. It happens before they go on board already. What type of shipmaster will I work with? How is the crew? If the food will be okay? If the contract will be too long or not too long? So anxiety, it affects really a lot of aspects in seafarers' mental health.
Thank you. It seems that more research it has to be done.
Exactly.
Oh, thank you so much, all panelists. Excellent presentations.
Thank you.
Now I would like to start the panel discussion, and we have some time for that. And also I would like to invite Charles Watkins also to provide his opinion. And I will give you one question and will call each of you to respond. What do you think? Based on your research experience and based on your observation and maybe some of your own clinical practice, what, in your opinion, are the most urgent challenges related to seafarers' mental health and well-being, which has to be addressed? May I call Rebecca to respond to this question?
Yes, thank you. Yes, well, according to my research, then I think workload is something that needs to be addressed, and that could be, monitoring the workload, distributing work tasks, and so on. And with that also comes crew change and so on, and rest hours is included in all of that. And I think also this has to be done at different levels. But then with that also comes management, the local management on board the vessel, where I think that has a lot to do with the well-being of seafarers. Also how tasks or how seafarers communicate with each other, the words that are used, how they can communication will have an effect on the outcome of well-being. So it all connects again to the work situation and workload. So management training also affects stress and so on.
Thank you, Rebecca. Okay. Yes, WMU does a lot of research on workload nowadays, and some of us are involved in this research. And I totally agree, management and communication are very important issues. Yes, maybe we can ask the same question to George. What do you think? What is the most urgent issue?
As Rebecca already mentioned, very common issues. Those are, let's say, the most challenging part of the seafarers' well-being. I can add here that important is, and what we saw during our research is that, seafarers are not familiar how to manage this stress. If they are in difficult situation, they are feeling bad or stressful, they do not know how to do dealing with this. This is the main challenge part of all of this, I think. They should get more familiar. Maybe the employer companies or recruitment companies should consider this and treat them according to this issue to provide more, no, increase awareness of them.
Okay, okay, I agree. Increasing awareness of this important issue is starting point in my view, training as well. Thank you so much. Maybe Maria, you have your something?
Yes, to add something else, because yeah, I agree with the previous panelist comment. In my view, I would say that everything is urgent when it comes to Seafarers' mental health and well-being. And I say that because, yeah, I think we see a lot of claim about mental health. We care about Seafarers' mental health and well-being, right? But there is not too much visible action in the industry from all fronts. So studies, literature, as I presented during my presentation, are clear, are well identified. So a poor work culture where blame exists, a poor working environment where there is in many cases harassment, discrimination, insufficient support. And we have the long-standing problems of fatigue, long working hours, workload, insufficient rest, decrease and insufficient short leave, long and unstable contracts. So all these are pressing challenges in my view. Mental health protection and support is very important, but we need to prevent mental health risk. So a preventive approach, addressing the risk factors contributing to mental health issues, is an urgent need. And as part of this preventive approach, I think we need to consider humanity and health aspects as core values. As core values.
Humanity and health aspects. I like this humanity aspect. Understand everyone, right? Who is around us. Thank you so much. Nihan, do you have anything to add?
Well, all my estimated professors, they have already mentioned many things, but I can summarize it like, depending on my research, a work-life balance. It's hard to handle. Yes, I've seen some of the comments they have written there that how can we imply this to the ship owners because this is in favor of them. I know it's in favor of them, but one of our students have lost his leg due to working 72 hours on board. So, I mean, this might go further, what I mean. Maybe he might have lost his life also. So we cannot overpass this issue like that over time. It's impossible. No, like 8 hours, 8 hours. They need to know that we are human and there are many human factors on board. And many of very valuable academics, they are working on human factor on board also, but this can go further. So, and also feeling belong to a ship owner is very important. In Turkey, there are some cases that a ship owner might switch to another, a seafarer might switch to another ship owner just because they are paying them 200 or 500 euros more or dollars more. So if the ship owners, they create their organizational climate and culture a corporate way and showing that they really think about their seafarers, I don't think that this quick switches between different ship operators might happen. So trust is important. They need to know that they need to trust their ship operator. They need to know that they are there for them. Isolation, loneliness, many things are being done. Charles knows more. But I think there are more things need to be done for the feeling of isolation of seafarers. Also, since the vessels have started to have internet connection, each seafarer, they isolate themselves to their rooms, and they have their phones and they contact with their families. So the culture of getting together in the room of ratings or in the room of officers has always destroyed right now. So the more they are isolated, the more they feel depressed. That's normal. So these are the things I think I can say.
Thank you, Dr. Nihan. And Charles, you have a lot of clinical practice. What is your opinion? What is more urgent issue?
Yes, and I agree with everything everyone's saying. It's wonderful to hear all these things because I see that in my daily practice when I visit ships, but also when I treat seafarers remotely. So it's really nice to hear those things. And yeah, it's an honor to be here. So thank you for inviting me. I guess I'm the odd man out here. I don't have any research to present, just my experience. But I think I'd like to just separate the question to two, the macro and the micro, if that's okay. I think on a macro scale, what we need, what the industry needs, what seafarers need, I think the most pressing matter is we need a global mental health regulation. And that is much like safety standards that ensure consistent mental health support across all vessels and all shipping companies and all owners and all P&I clubs. And I think these policies need to be mandated and standardized because we still don't have that. We have it for medical, and everyone knows and says medical is equal to mental health, which it is. We separated it back in the day. That was very unfortunate, but it's one system, right? So why don't we make it just as important as the telemedicine and radiomedical advice they have? That's the first part of macro I would start addressing, because I think that's a very pressing issue. And I think as a clinician and someone who really likes or appreciates the diagnostic processes, what do we need? We need sleep, we need rest. All right, that's the basis for everything. If you don't get enough sleep, you're not going to be focused, you're not going to be able to remember things, it's a dangerous environment, a vessel. We want to be focused. We have to be rested. So let's start addressing the elephant in the room and install systems that assure, that's the important word, that sleep and rest hours are guaranteed, right? It's not that difficult. We know it's we know what they're doing, also thanks to Maria. And let's just be honest about it, and let's just install systems that work and give them the rest and sleep they need, because they are doing a very dangerous job in a lot of parts of the ships. A lot of parts of the vessels. Yeah, so that's the other part of macro. And I think one other thing, which is maybe going into micro a little bit, is medications on board. Why don't we have medications that could address short-term mental health acute issues, right? It's not that difficult to do. The medications we have on board have been there for a very long time, and they haven't been updated in a very long time. Why don't we get some medical personnel together, some psychiatrists and other people that are experts in medications in this area, and have them, update the chest, so seafarers can get, immediate help if it is necessary. That would be nice, because it's really difficult to manage a case for me and my team with the medications that we have on board when we have crisis situations, right? Because there's only a very limited amount that we can use, and we work, of course, with radiomedical advice, but again, we're limited. And on a micro level, I think a lot of great things have been said. Cultural specific food, that's important, right? It's more important to some cultures than to others, but it's a sense of home, it's a sense of belonging, it's a sense of togetherness, of celebration, of coming together. And looking forward to the main event, so to speak, that offers not just a present feeling of rest and relief, but also a sense of home and community. I think that's something that often gets overlooked. Access to the internet, very important. Why are we treating them differently than everyone else in the world? We have this issue that they're treated differently. We need to stop doing that. Yes, the internet has dangers. Yes, social media is absolutely horrible for anxiety and depression rates. But it's about communication, as every one of you said, to the families, to home. Let's give them internet so they can communicate properly in the quality they need to the people they love. And I guess I guess last but not least is yes, the work culture, the psychological safety, and the trust, because trust is a feeling. And if you have a feeling that you can trust your environment, your peers, then you're going to look out for yourself and others. But if you don't have that, it's dangerous. So we know from other research that the most efficient and productive teams are the teams that have psychological safety in place, which goes with work culture and happiness and trust, right? So yes, those are the things I think, and the cornerstone of all that is education. What we're doing here, what WMU is doing, the education and the normalization of this will bring this, quicker, further, up to a speed where then big bodies of the maritime industry will be able to ignore it any further. Thank you.
Thank you, Charles. Thank you. Excellent. And I like the idea of dividing this micro and macro level, and there are many things to do. Yes, the discussion will not end today. I think it's just continuing, not starting, but we will continue working in this direction. And by ending this session, we hope that this platform offers a unique opportunity to share opinions and discuss the issues. We believe that all together we can make changes in maritime industry and foster the culture, changing culture of care. With many thanks to our panelists and participants, I would like to ask Maria Carrera to close the session.
Yeah, sure, but yeah, a lot of things, were said during this session, and we will continue in the next one. In fact, some of the panelists, some of the participants already advanced some further discussions, like the importance of food, the importance of internet connection, and many other things. And as Charles just mentioned, and in my view, is a very good, message to take away, which is why seafarers are treated differently from any other person or worker in the world, right? Why do they have different standards in terms of for how long they work, the kind of food they have, the kind of medication they have on board, and the kind of support while working and do the important mission they have in this world. So just to finish, I would like to thank everyone, as Inga did, for panelists, of course, for joining us, participants for participating in this lively chat. And we would like to invite you to join us for the next session that will take place on the 14th of November. And in that one, we will have 4 more researchers that will present topics such as sleep problems, food provision, sexual abstinence, and also health promotion and education among seafarers. So this is all from us. So stay tuned, stay healthy, and bye-bye for now.
Thank you, Maria. And special thanks to our alumni office. Thank you, Charlotte and Wu and others who will make this happen. Thank you so much.
Bye-bye.
Thank you, everyone. Take care. Bye-bye.